Hello, this is Dallas Holliday, PGY4 with Midwestern University Department of Emergency Medicine. Today we're going to be discussing bedside renal ultrasound in the emergency department. So as far as our objectives, after this lecture, you should know who will benefit from a bedside ultrasound, what basic kidney anatomy looks like on ultrasound, and how to identify hydronephrosis and accurately measure bladder volume. So first let's start with who we're going to scan. Renal ultrasound is useful for a number of patients. Firstly, in patients presenting with flank pain or abdominal pain and hematuria, it can be quite useful to rule in nephrolithiasis, potentially saving patients the radiation and cost from a CT scan of the abdomen and pelvis. Additionally, renal ultrasound is going to be useful in patients who present complaining of an inability to void and possible urinary retention. Ultrasound can also be used to check the volume of the bladder and look for hydroureter. Additionally, ultrasounding due to flank pain or back pain, it is good practice to take a quick scan of the aorta and look for abdominal aortic aneurysm. All of this can be completed at the bedside in a few minutes. Next, where do we scan? For this exam, we'll be using the low-frequency curvilinear or abdominal probe. It's important to scan both kidneys in the longitudinal and transverse planes, looking for hydroureter, which suggests nephrolithiasis. So for this exam, we're not actually going to be directly visualizing the kidney stones or stones in the ureter. We're going to be looking for that hydroureter. I usually start on the right side since I find it's easier to locate the right kidney, which is going to be located a little more caudal than the left due to the liver. Start with the probe below the ribs in the mid to anterior axillary line and scan caudally until the kidney comes into view. I typically start in the longitudinal orientation, but there's no advantage to either as far as I know. That's just my personal practice. When assessing the longitudinal view, the probe indicator should be oriented towards the patient's head. Once the kidney is in view, fan through the kidney looking for hydroureter. Then turn the probe 90 degrees so the probe indicator is to the patient's right and fan through the other view. Next, move to the left kidney. I find the left side is often a bit more challenging since the left kidney is slightly more caudate and likely to be shadowed by the ribs. As with the right side, start just below the rib cage, usually mid-axillary line, and slowly move caudate until the kidney comes into view. Repeat the same fanning process as with the right kidney. The tough part about the left kidney is there's often going to be rib shadowing, so that can be challenging. You can have the patient take a deep inspiration and hold it. Sometimes that pops the kidney out from underneath the ribs, but it might just be a bit of messing with the transducer to try and get the appropriate view. All right, so we've talked about where we're going to place our probe and who we're going to be placing it on. Now let's talk about what we should see. Several structures will be evident on ultrasound when assessing the kidney. The cortex and medulla will appear gray, and the medulla may be slightly darker than the cortex. Renal pelvic fat located in the center of the kidney will appear brighter, usually white. As with any ultrasound fluid, such as that visible with hydroureter, will be black. You shouldn't see black fluid in a normal kidney. Additionally, you may see cysts, which will appear as simple hypoechoic structures located in the cortex. So here we see the right kidney as evidenced by the liver superior to the kidney. This is a normal kidney. You can see we've got this sort of gray cortex here, and then the brighter renal fat here in the center. Notice there's no black anywhere in this kidney. Here's another example of normal kidney. Again, we've got this gray cortex surrounding this renal fat. And that's normal. That's what we want to see. And this is also a right kidney. You can see the liver is up here. So next, now that we've talked about normal, let's talk about what pathology looks like. So when we're hunting for the diagnosis of urolithiasis, we're actually not going to be, again, looking for that stone because that's rare. We're actually going to be looking for the effects of the stone, i.e. hydronephrosis. Hydronephrosis will appear as black puddles in the brighter renal fat. Acute hydronephrosis is associated with normal appearing cortex. As the hydronephrosis progresses, however, in severity and duration, it may result in cortical thinning. This renal image demonstrates mild to moderate hydronephrosis, and you can see that here as these sort of black puddles in the kidney itself. This is all evidence of hydronephrosis. There are degrees of hydronephrosis, though absolute grading is less important in the emergency department. It is more important to recognize mild versus severe. As this chart demonstrates, mild is going to be more puddles, and as it becomes more severe, they will coalesce into these stripes of black. Severe hydronephrosis also involves thinning of the cortex, as you can see in this most severe image here. So here is an ultrasound image of severe hydronephrosis. You can see that our small puddles have coalesced into this larger black hydroureter, and that there's actually starting to be some thinning of the cortex and loss of the structure here. That's bad. Here is a lovely video from the ultrasound gurus at 5-Minute Sono demonstrating hydronephrosis in video form. So again, you can see they're fanning through the kidney. And you can see here, you've got these large areas. Obviously, the ureter and renal pelvis should not be visible that large. So just how good is point-of-care ultrasound for finding urolithiasis? Turns out pretty darn good. This was a great study brought to us in part by the ultrasound program at Cook County Stroger Hospital, published in a small medical journal you may have heard of, the New England Journal of Medicine. They compared CT of abdomen pelvis, ultrasound with radiology, and point-of-care ultrasound. We're going to be discussing this paper in depth for Journal Club, so I'm not going to go into a ton of detail, but long story short, this paper randomized 2,759 patients to receive a CT scan of the abdomen and pelvis, a formal ultrasound with radiology, or a point-of-care ultrasound. They found that serious adverse events did not differ significantly between those in each group at 6 months, 11.2, 10.8, and 12.4% respectively. Additionally, diagnostic accuracy did not differ between the groups. So, point-of-care ultrasound is not only safe when compared to other modalities, but also diagnostically accurate, and something we should be doing in the department. Next, we're going to talk about scanning the bladder, which should be part of every renal exam. Again, we're going to be using that low-frequency curvilinear probe to scan through the transverse and sagittal plane, fanning through the entire bladder to obtain an estimated bladder volume and evaluate for any masses, stones, distension, etc. So when we talk about measuring the bladder volume, there are a few different methods, but the most widely accepted is the prolate ellipsoid equation, which states that bladder volume in milliliters equals length times width times height times 0.52. Some of our machines are actually going to have this measurement capability, but it's not necessary. You can do the measurements yourself and then do the calculations. First, you're going to use the sagittal view to obtain the length and height measurements. A key aspect of this exam is that the length is going to be the diagonal length of the bladder as demonstrated here. So you're actually going to be looking for this diagonal length for your width. And then here is your height. Then next, you're going to rotate your probe and use your transverse view to obtain the width as shown in this second image here. So here we've got our transverse view and we're getting our width measurement. Normal bladder volume is 300 to 400 mLs. Post-void residual should be less than 100 to 150 depending on your reference source. So if you've got something larger than that, then you know that you're retaining. As always, thank you for watching, especially this short one. Don't stop relieving, and feel free to message me with any questions at Dallas_holiday or dallas.holiday@gmail.com. Here are a list of references and resources used for this presentation if you want to do some deep dive learning on your own. Again, thank you guys, and I will see you in ultrasound lecture.